Around 300 children and 20 women die in Uganda, especially around the time of delivery. Although well-established medical care exists to prevent these deaths, most women and children in remote and hard-to-reach areas cannot access this care. In Rukungiri district, a maternity waiting home at Kisiizi Hospital is helping bridge this gap. Banajiga with a report.
At this mother's waiting home found at Kisiizi Hospital in the southwestern district of Rukungiri, we caught up with a Harizire novice, aged 20 and a resident of Kafunjo in Nyarushanje sub-county, Rukungiri district. With about 3 weeks to deliver, Novice had spent close to 2 months at this home receiving free maternity care. This was after she started getting complications and decided to come for treatment. The 24-bed capacity mothers waiting home receives mothers from fund-wide with complications to have safe deliveries and timely care, according to Rory Nasingwire, a registered midwife working in the facility.
So they come here, they wait for labor. Every morning we come, we examine them. In case of anything, they come and tell us. We also have a matron at night who takes care of them. In case of anything, she has her room there. They go, they knock. Then she brings them to us, or they call us. We have a maternity phone up there. We come and fetch them, then we do the needful.
Kisiizi Hospital Medical Superintendent Dr. Ian Spillman highlights the genesis.
And it came out of a tragedy. The tragedy was that 2 mothers arrived here in Kisiizi already dead because they couldn't get to us in time when they developed complications of labour. They were from a poor village in a remote area, and they had trouble getting transport. It was in the middle of the night, and it was such a sad thing to happen. And as a result, Kisiizi decided to build a 24-bed mothers waiting home. And this has proved very successful and very popular. So now mothers can come electively, which is much cheaper than coming as emergencies.
Dr. Ian says all the services at the waiting home are offered at a small fee of 5,000 Uganda shillings for each mother for the entire period at the facility, unless they are members of the hospital insurance scheme.
So mothers may be in the home sometimes just a couple of days, sometimes a couple of weeks, however long it takes. Some of the mothers we advise medically that they need to be there. For example, if the placenta is low-lying, we know they will have problems when they go into labour. Other mothers will come because their location is remote and they know they're going to have trouble getting here. So there's no limit to how long they stay in the home. If they're members of our insurance scheme, our community health insurance scheme, then the admission to the home is free. And that has also been a benefit.
Reports show that every day 15 women die in Uganda from pregnancy and childbirth-related causes. 94 babies are stillborns and 81 newborn babies die. According to World Health Organization, maternity waiting home strategy has greatly reduced maternal and perinatal mortality by improving access to skilled birth attendance and emergency obstetric care, particularly for women in rural and remote areas. Bernard Yiga, UBC TV, Rukungiri.